So in this video, I am going to be telling you about what exactly is anatomy. This is a video that I wish I had seen during the start of my first year. So if you are at the beginning of first year or in the mid of first year, this video is exactly for you. I am Rohith PVR, a second year. I have become third year. So I am Rohith PVR, a third year medical student at Madurai Medical College. And in this channel, I make videos about spirituality, stoicism, and obviously videos like this, MBBS stuff, academics. So if this sounds like a cup of tea, then do subscribe. Anatomy is basically simply put the study of human organs, the relations, various arteries, nerves, basically whatever is present in the body, whatever you can see physically in this body. Like for instance, you can physically see the hand, and once you dissect, you can physically see the various muscles, the nerves, and so on. Calling anatomy a subject of studying only physically visible stuffs would be misleading because for instance we can't really see the various lymphatic channels and we can't really see the various nerves, but then you get the point, right? Basically it's about the study of the physical dimensions of this body. So in this video I'm going to be telling you about what exactly is anatomy and why you should study anatomy, the reasons behind why you should put that effort into anatomy, and what you can get from anatomy. Because you're not studying simply, right? You're studying, let's face it, you're studying so that you will get something in the future. So I'm going to be telling you what exactly you will get from it in the future, and also how it will be useful to you as a doctor. Since I am a third year medical student now, you can trust me, I have a decent knowledge about first year subjects and also second year subjects, and I have a basic overview about the life of a doctor because my father also is a doctor. So let's get on with it. I'm going to change this into a chit chat video. This is absolutely not scripted. I'm just going to talk to you like my friend because I want you to succeed. So anatomy is basically the study of the body relations. In anatomy, your main focus should initially be about building a 3D human body within your brain. When they ask you about liver, then you should immediately imagine about the entire liver and then also the surrounding capsules, the surrounding space. I mean, I can't really remember much now, but once you're done with first year MBBS, on the day of exam, you should be capable of doing this. So this is basically the idea behind anatomy. So once you're done with anatomy, you should be having a 3D view of all the organs within the body, and also you should be having an idea about the various relations between different organs, between different nerves, between organs and nerves. Before I started with anatomy, I actually thought that relations are not important. But fun fact, relations are the most important, and in fact, relations are the very reason you're studying anatomy. You basically need to know that this artery lies next to this nerve. So if I have to do something to this artery, I might make sure that I don't damage this nerve. This is the concept. And also, for example, even today morning, I happened to be in the obstetrics and gynecology postings, and I saw LSES. So basically in this LSES, you will be cutting through the skin first, then you will expose the fat layer. Usually in most people, you can see a lot of fat. So once you cut through the fat, you can see the rectus sheath, and once you cut through rectus sheath, you can see the rectus muscle. And once you separate the rectus muscle, you will be able to see another layer, and then beneath that you can see uterus. So you have to cut through the uterus and take the baby out. This is how LSES basically occurs. Once you are done with anatomy, you should be having a clear-cut idea about all this, and you should be having a very clear-cut knowledge about all the various relations. And I have told about what exactly should you be studying from anatomy, and now I am going to be giving you some tips on how to go with anatomy. So first of all, you should have a basic knowledge about the various bones in our body. Once you have a basic overview about the various bones in our body, you will have an idea about the various movements that are possible in our body. For example, there are 3 different bones within this region. So you will be able to move at this place and you will be able to move at this place. This is kind of obvious for now, but you will be learning more details in the future, I mean in anatomy. So this is one, so you should start with studying bones first, and then you should start with studying muscles. Let me put this straight, muscles are not really important. Only few muscles are important. For example, like deltoid and probably this muscle, biceps brachii, everyone's favorite. So you have to go through the previous questions and just make sure that you don't miss on the various important muscles. Once you're done with the muscles, you should study about the arterial supply around the muscles, the nervous supply to the muscles, and that's it. That's basically anatomy. This is all about anatomy. And in some cases, you would have to study about the fascia. For instance, in femoral canal, the importance of fascia is clearly seen. So this is how we approach anatomy. So now we'll be seeing about what anatomy can give you. I would say that by the end of first year, your anatomy will be thorough. But once you get into second year, your anatomy knowledge starts to degrade slowly and slowly. And once you enter third year, almost you won't remember anything. But then every information is still at the back of your head. But then you won't really be able to recall that. So I believe that you should try to revise in second year. Like you have to touch anatomy, you have to be in touch with anatomy from time to time. And then in third year also you can try to revise anatomy. And in fourth year you will be having surgery. So in surgery it is absolutely anatomy. You will be studying the complete anatomy, at least the various surgically important anatomical sites. So you will be able to revise during that time. So what I would suggest you to do is that just study anatomy in detail in the first year, complete fully, and then you'll be having every information in the back of your head. Once you study, you are not actually losing information. You will only be losing the ability to recall the information at the right time. So just put all that information into your brain, and when the time comes, just revise, practice some MCQs, and do some questions. And once the time comes, that is once you enter fourth year, you will be almost clear with surgery. So coming to the books that I have used, the only book source that I have used is BDC. So this is my BDC. As you can see from this amazing, absolutely healthy physical condition of this book, I have definitely studied really well. So I think you can see some. So this is kind of how I have studied this book. So this is how I have studied. And this book, this part now, lower limb, abdomen, pelvis, is my favorite part. So I have studied this pretty much in very detail. So please don't go with Gray's Anatomy. It's absolutely pointless, even for reference. Everything is available in this amazing book called BDC. There's also this book called Vishram Singh. I haven't really gone through that book, but I've seen some diagrams from that book. The diagrams in Vishram Singh are amazing. So maybe you can study the theory aspect from BDC, that is BD Chaurashya. And for the various diagrams, you can go with Vishram Singh, because in Vishram Singh, the diagrams will be in line diagram format, so it will be more easy to study from that. So there is this amazing book for embryology by Dr. Yogesh Shantake. I would strongly recommend going through that book. That is actually amazing. And now I'm going to be talking about the various mistakes I did during my first year for studying anatomy. Mistake number one would be, I didn't really spend much time in anatomy since the start, because I felt like I just entered college. So I always wanted to study really well, but in the first 2 months I didn't really study that hard. I was just distracted the whole time. So try not to be distracted. It's okay to have fun, but at the same time you should also study. So be in touch with anatomy throughout the year. And then point number two, have complete focus during dissection classes. Dissection classes are vital for your true understanding of anatomy, because how much ever you study from this book, unless and until you see the actual cadaver, unless and until you see the actual muscles, the nerves and the various blood vessels, you will never be able to remember anything. So make sure that you use these various dissection classes your college is offering you. And also coming to histology, histology is kind of important. Don't just leave it aside. Once you understand the normal histology, you will be able to understand the pathological histology that we will be studying in second year. So having a decent knowledge of histology during my first year actually helped me a lot during my second year. But I wish I had studied a little more in detail. So make sure you study histology a little bit more. And also embryology. Would you believe me if I told you that anatomy is pretty much conceptual? Because the whole year I was trying to mug up, but then during the end of first year, during the exams, I had to go with embryology. I had to study embryology for the exams. And once I started studying embryology, I realized that embryology is actually what you should be studying at first. And once you are thorough with embryology, the various relations in the body just make sense by themselves. That's it. Because if something arises from this and then something arises from this, and both of them are going to be at the same place, then obviously the various other structures that are arising from this part is also going to be kind of near with this particular organ. Embryology of abdomen is even more important, because you can make absolute conceptual sense of abdomen simply if you understand embryology fully. So make sure that you study embryology fully. And finally, knowledge is all that matters. Marks, I wouldn't really say that marks don't matter, marks are kind of a marker of how much you have studied, but it doesn't mean that if your marks are like really bad, it doesn't mean that you haven't studied at all. Sometimes you simply don't revise. For instance, during my second year exams, I wasn't really in the mood of revising every single subject. I had studied fully, I had completed every single book before exams, but since I didn't really revise, I wasn't able to recall much during my second year exams. So this definitely would have impacted my marks, that's for sure. So knowledge is all that's important. Try to gather the knowledge, try to revise at the right time, and also try to do some MCQs. That is something that I missed during my first year. So try to do some MCQs, because given that everything is turning into MCQs, NEET, UG, NEET, PG, everything, just everything is, next, everything is turning into MCQ pattern. Practicing MCQs from the start will definitely help you. And also I forgot to mention this, there is this book called Netter's Atlas of Human Anatomy. You should definitely check that out. It has amazing illustrations of the various anatomical organs in our body. So try to check out that book as well. It has actually helped me a lot. And this is a video in which I have talked about what exactly is physiology, that is in the same order. So make sure you check this out. And follow me on Instagram, and definitely feel free to post doubts on my Instagram. I would love to reply back to them. Thank you for watching, and I'll see you in the next video.